Hi everyone, welcome back to my channel. This is Dr. Pratibha Chauhan this side, and I hope all of you are doing well and your preparation must be going absolutely on the track, because I am hoping that all of you are taking INICT very seriously, and INICT is around the corner, so I feel everybody is targeting it. And those of you who are not targeting it, my sincere advice to all of you will be that please just go and give the exam. Even if you are not targeting it, or if you're not attempting it for a decent rank, just go and give it as a GT, and set it as a target that you have to complete your certain revisions or certain part of syllabus, and this much amount of your preparation should be completed till this particular point, right? So even if somebody who is going and targeting Neet PG, it's okay. It's there is no harm in not being targeting INICT, but I will really advise you to just go and give this particular exam, because these days even the Neet PG exam is getting very clinical and conceptual, and long term questions are appearing in this exam as well, like they're coming in INICT. So I guess if you're giving an exam similar to something which you're going to appear as a main Neet PG exam, so I guess it is going to prepare you mentally also, and will make you understand that how you are supposed to analyze yourself and how you are supposed to adjust in that situation, right? So yeah, just take the exam a little seriously, right? Now moving ahead, as I have earlier discussed about the Neet PG basic strategy of the preparation, about the subject-wise timeline, what should be the timeline for somebody who's starting fresh or somebody who has already initiated the preparation long back in their internship beginning, right? And also about can you crack Neet PG if you start right now, and INICT cracking strategies, and also day of a Neet PG aspirant was my last video, which I'll really recommend almost all of you to just go and have a look at it, because I guess it is going to really help you and plan your day accordingly, right? The next thing which I personally really want to talk about will be certain notebooks which you should have in your hand apart from your notes, to be able to revise the entire syllabus, to be able to concise and consolidate the entire syllabus a week before the exam. Right now, we all of us have our notes in our hands, so there is no confusion about that. All of you will be having your either handmade notes or your printed notes for revision, right? Now, apart from that, after the notes, obviously the images, and I've told about it as earlier also, that you have to save your images, take the screenshots of important images from your PDF and store them anywhere you feel like, to be to be able to revise them whenever you are free and whenever you are also going ahead in the subsequent revisions. And thirdly, and the most importantly, are the previous year's questions. You will keep on solving them as many number of times you can, and you will save those questions. Also, you will bookmark those questions, or you will take a screenshot of it and you will save them as well, to know that out of the previous year's questions, these are the very important previous year's questions which I'll be revising also in the subsequent revisions, right? And these are three things which you obviously cannot avoid. Now, what are the 3 or 4 important notebooks you should have in your hand? 4, I'll say, right? First and the foremost and the most important, and you will be hearing about this notebook almost everywhere, will be your 20th notebook, or your choti copy, or your notebook to concise the stuff and your syllabus, to be able to revise in the end, right? Now this 20th notebook is extremely important, trust me when I say that, because this is going to come to your rescue a week before the exam, or 10 to 15 days before the exam, and will help you in revising the entire syllabus in this one mini booklet. And this will have all the important stuff from your notes, all the important highly volatile part of your notes will be there in this particular notebook, and you will not have to revise your notes from head to toe, right? So it's a very important notebook. First thing about this notebook will be that you have to start making this notebook from your first revision, not from your first reading, because in first reading we feel everything is volatile, even first revision we feel there are a lot of things which are volatile, but I guess first revision will be the right time for this notebook, because I guess then you'll have good amount of time to revise it in further revisions also, right? And also to keep on updating it and modifying it accordingly as and when you're going ahead with the revisions, right? Now, what should be we writing in our 20th notebook is the most important question which we are confused about everywhere, right? Now, my idea of 20th notebook, the way I made it will be like this, was like this. First, I divided this notebook in 19 parts, okay? Subject wise, I divided the notebook in 19 parts, and I gave around like 4 to 5 pages for the small subjects, 7 to 10 pages for the medium ones, and 15 to 20 pages for the long ones, like medicine, surgery, OBGYN, PSM, path, pharma. I gave around 15 to 20 pages for the long subjects, right? Now, your strategy of making this notebook should not be that you have to just put everything and anything out of your notes. No, please only and only write the keywords for particular diagnosis, very important one-liners in this particular notebook. Do not just rush into making this notebook for the sake of making it. Please don't do that. If you're doing that, then the purpose is actually will not be solved, and then I will really advise you to not go ahead with making this notebook, because if you want to write everything and anything from your notes in this notebook, then there is the idea of 20th notebook is not this. For the notes is sufficient. We can go and revise your notes only for nothing. Now, what should be there in this 20th notebook? Let's just focus on this particular thing. This is a very, very important list. I will put this list out there on the Instagram also, and I will attach this in this video as well. Please, please, please listen to this thing very, very carefully. You have to write all the important tables and flowcharts. Whenever you're reading notes, whatever tables and notebooks and flowcharts you are coming across, please go ahead in writing these in your 20th notebook, right? Second most important thing will be all the appearances with similar names. So for example, tram track appearance is in ophthalmology as well, is in Sturgeber as well, and is in bronchiectasis as well, right? So write all these appearances, in different diseases, the same appearances, right? All such examples together so that you have an idea, okay, from where the question is actually popping. Third and the most important, most common, most specific, most sensitive investigation. This should be a very important list, because sometimes the examiner is going to directly ask you this particular question, right? Then the most common cause, very important. Then HLAs, list of HLAs, highly, highly, highly important, right? And then investigation of choice. In almost all the subjects, you have medicine, you have surgery, OBGYN, ortho, ENT, eye. What is the investigation of choice? Drug of choice, treatment of choice, management of choice. Okay. Then all the important science. You have a lot of named science in ophthalmology, in surgery, in medicine, in OBGYN. Please write them, all of them together at a place. Then cancer stagings. Very importantly, write all the cancers, be it ENT, be it OBGYN, be it surgery, and be it orthopedics. Please write all of the cancers together and make a checklist of all of the cancers, write what is the name of the cancer, what are the important tumor markers, where it is going to metastasize, is there any important feature to be learned about this cancer, what is the most common site of mets, and is there any specific surgery which we have to, the name surgery which we have to remember. So please make a checklist of all of these things. I guess you have around 20 cancers in surgery, around 7 in OBGYN, and you have around like 7 to 8 in orthopedics, and 2 to 3 in ENT. Okay, so you should have a list of all of these cancers together, because in the end, cancer staging you cannot learn, because trust me, staging नहीं याद होती है, important वालों की भी नहीं होती है. Breast की याद कर लो, breast I feel is very, very important, but apart from that, rest everything is very confusing. So I don't believe in the idea of rectifying the staging at all. Then write all the mnemonics, right, and all the recent updates which you feel like you should know before the exam. You should obviously write the recent updates also. Then the newly approved drugs, all the newly approved drugs in pharmacology and even other fields as well. Please write them, because INICT is very fond of asking about the recent updates and emergency medicine. Write all the trials, okay, write all the paraneoplastic syndromes, very important. All the scores, named scores in surgery, in medicine, in OBGYN, please write them together at a place. Medicine may you have so many scores, surgery may you have so many scores, OBGYN may you have so many scores, and named classifications. Please write them. Then diagnostic criteria, OBGYN may, for example, you have diagnostic criteria for this eclampsia, impending eclampsia, pre-eclampsia, severe eclampsia, gestational hypertension, what is chronic hypertension. You have to write all of them together. What is the definition, what is the diagnostic criteria of preterm labor, so you have to write them together so that you know that if this is asked in the exam, what all diagnostic criteria I have to consider to be able to come to diagnosis. Similarly in surgery, similarly in medicine, you should know medicine, you have so many criteria in GIT, in CVS, in CNS, in respiratory, in rheumatology, specifically rheumatology has so many of them. Write them all together, right? Then antibodies in rheumatology, very important. You cannot just skip it. There are so many antibodies in dermatology. In fact, I have posted all of them on my Instagram page. Please go and have a look there. Right, then write all of the formulas of PSM, of medicine, and of pharmacology. Right, PSM, medicine, pharmacology. PSM का PSM में, medicine का medicine में, and pharma का pharma में you have to mention. Then very importantly, write all the schemes. Specifically, this is for PSM. PSM में you should also be focusing on all the important schemes, all the important upcoming schemes which are coming out there, and all the important updates about the health programs. ठीक है, health programs में जो basic है वो तो we all of us know, but we should know what are the important updates as well of the health programs. Okay. Then micro में there is a very important thing which you have to obviously consider is all the important list. For example, bacteriology में gram positive, gram negative, oxidase positive, urease positive, है ना, and virology में you will have helical symmetry or icosahedral symmetry. You have to write all of these lists down together. Parasitology में list of all the eggs, list of all the intermediate host or the main host. You have to write these lists only to be able to remember them. Without writing them together, you will not be able to remember and recall these particular things in your exam. Okay. Now this 20th notebook, the list I have told you that this all should be in your 20th notebook. Okay, subject wise you have to make this 20th notebook, and apart from these lists also, when you are reading your notes, and if you feel there is a very important part of your notes, there is an important one-liner or there are few keywords which you need to know to be able to come to a diagnosis, do add them subject wise there as well. Right, skin ka skin mein, psychiatric ka psychiatric mein. Do not mix this notebook. Do not make it maybe another set of notes. Don't do that. It should be separate subject wise. That is why I'm emphasizing it again and again, so that if you have to pick up skin, these are the 5 pages of skin which if I am revising, I am grabbing and getting a hold on the entire subject. Okay. Now, as I've told you earlier as well, that you have to only add keywords. Secondly, you have to revise. Now, how you have to actually revise this notebook? Making तो हो गया, and first revision तक की आपकी बन भी जाएगी. This notebook will be absolutely complete as well. You have to revise 2 to 4 pages, 5 pages, 10 pages according to your efficiency every day. Right, and target to complete the revision of this notebook in 1 to 1.5 months. Please make a habit of revising this notebook every day, so to not keep it till last, and to not have a burden of just revising this notebook in the end, because in the end if you will be revising it, you will feel like it's a very new stuff and you will just avoid doing it. So don't not to enter into that situation, revise it 3 to 4 to 5 to 10 pages every day, and complete this revision of notebook around in like a 1 to 1.5 months, and then you can plan for the revisions accordingly. For the revisions will obviously take you lesser time, because you have read your notebook in the first reading perfectly. Right now, a very important thing is that you have to read this notebook, and you have to only write the stuff which you very clearly have understood and very clearly will be digesting also. Take care, this notebook should not have anything and everything. This should only have the stuff which you will be able to remember and recall in the exam. Okay, not extra, nothing extra. So this is about the 20th notebook, and I feel this notebook has to be very important. And if at all you feel like that apart from the 20th notebook, I want to make a separate notebook, or maybe something extra from this 20th notebook, I guess that is only going to create additional burden on you. So your 20th notebook should be good enough. It should have good number of pages to be able to incorporate all 19 subjects into it, and for you to be able to effectively coming out of being able to revise this particular notebook, right? Then the second notebook which I feel should be coming your way should be your wrong diary. Now this wrong diary is highly important. Why I'm trying to tell you that it is very important will be that this notebook will have wrong diary in the beginning half and the last minute revision topics in the last few pages. That means you can divide this notebook in 2 parts. The initial part will have wrong diary, and the second half will have the last minute revision topics. The wrong diary will have the wrong topics of 3 important things: the previous year's questions, the grand test, and the subject wise test. अब आप initial 3 half को जो initial half है आपका उसको आप 3 parts में divide कर लें: previous year's question, subject wise test, and GTs. And previous year's question में भी you are going to obviously give 1 page for every subject, and you will write, suppose skin आपने उठाया, you will mention okay, in previous year's question, while I was solving previous year's question, now on every page you will make a column, right, of what? Wrong topics, volatile topics, and the new topic in every subject. A previous year's question may sometimes you will feel like, okay, fine, I have not been able to revise this topic in my exam and in my from my notes, and that is why I have done this topic or marked this thing wrong. तो वो तो आपका wrong हुआ कि you have not been revising it well enough, and that is why that topic went wrong. Secondly, volatile will be something which you are not able to recall and remember. So this you will write here as well, and you will write in the last minute revision topic also, जो आपने second half में बनाया है. Okay, you will add this list there as well. Thirdly will be the new topic of this particular thing. This new topic will be something which you haven't heard of. So you will write it, you will write the topic, you will write the explanation as well. So previous year's question वाले section में आपने 19 pages डाले. Every subject you will have wrong, volatile, new, and you will mention कि okay fine, these are the topics which I have to go ahead with. Similarly, subject wise test में you will give one page for all the 19 subjects. Again, wrong, volatile, new, and when you are analyzing the subject wise test, you are going to put that. Thirdly, in your GTs as well, when you will be assessing that GT number 1, wrong, volatile, new, write subject wise anatomy, physiology, BChem, and corresponding to it you are going to write the most important wrong, volatile, and new topics. Now why I'm telling you this wrong, volatile, new? क्यों? क्योंकि when we are analyzing the GT ना, you should know what actually is your weak area. The new topics are not actually your weak areas at all. This is something new and it's new for everybody, right? Wrong and the volatile part is your weak area, and specifically the wrong part is your weak area क्योंकि something which you have not been able to revise from your notes is coming in the GT, so you know that this is important and you cannot skip it, right? And volatile will be, you will be knowing that I have to revise this thing a day before the exam or maybe a week before the exam, so you know what you have to actually target. This notebook is come to your rescue very importantly 15 to 20 days before the exam when you are completely confused अब क्या revise करना है. Okay, so second should be your wrong diary plus last minute revision topics. Third notebook should be your test and discussion notebook. Now it's optional. Why? Because not every one of you will be a test and discussion student, and that is why I am not putting it as the most important notebook. Those of you who are there as a test and discussion student, I will really advise, obviously test and discussion must have passed till now. It must have completed till now because it ends 3 to 4 months before the exam. But my advice to you only will be that if at all somebody is still remaining with the test and discussion, please make a separate notebook for that, because you should have those notes in your hand to be able to differentiate what are the main notes and what are the TMD notes, right? But for somebody who have not been a part of test and discussion and still is confused how I have to go with the syllabus, how should I plan my strategy, what is the time I have to enter and exit a particular subject, matlab you are completely confused how to go with the preparation and you are starting now. There is a course by DAMS which is fast track test and discussion. Again, it's not a promotion at all. Please, I will really like to clarify it here. It's only why I really want to tell you will be is because I want people to know about it, because it is going to be really helpful for somebody who is very confused at this point of time, who do not have a strategy in hand. This course will give you the right schedule, the right number of days, the right strategy, will tell you the most important questions out of a subject, will be helping you how you have to go ahead with the preparation also, and they'll be winding up it by December or mid-January. So you will have good 1 to 1.5 months even before the exam to plan your revisions according to this test and discussion, according to what are the important topics which have been discussed. So I guess they're going to start it in October. I guess they will start it then, so you can just visit their app or maybe text the corresponding person ahead to inquire about it, right? Again, not a compulsion, only for those who are confused in their preparation. Those of you who are already prepared with the strategy and are going good with the flow, keep on going ahead. No need to add this particular source in your preparation at all. Okay, then the next thing will be a very small mini diary or a to-do checklist. Very important, because I feel this checklist is going to keep you right on the track. This checklist, as I told you earlier in my previous video as well, also subject wise apne anatomy, physio, BChem, you have written all 90 subjects, and upper you have mentioned what notes, images, previous year's question bank or custom module, subject wise test, your test and discussion, your GTs, and your CBTs, and other resources if you have your 20th notebook, right? And you will keep on marking it once you are done with that particular thing of that subject. Once the subject ends, you can obviously mark that thing out. And also in this notebook you will write your to-do list of every day. आज क्या करना है, and आज रात में कल क्या करना है. You will plan something, someday it might happen कि some backlogs are there, so you will obviously write it on the next day कि okay, this is the backlog which is remaining, I have to adjust my time according to this because I have to complete my backlog also. So I guess this is going to tell you कि okay, in a day if at all you're giving 7 to 8 or 9 hours, तो अगर backlog रहता है तो you have to give 10 to 11 hours in that day, है ना? So it keeps you on track. So I personally feel that it's very important for all of us to have this checklist because it really helped me, and I was very clear every day in the morning that this is something which I have to do in the entire day. This is how my day should look like, and I used to plan it briefly a day before also. And early morning when I used to wake up, I used to just cross check, is there anything extra I have to add into it. Okay, so the 20th notebook, the wrong diary plus the last minute revision topics, the test and discussion notebook optional, the mini diary or the checklist, and your notes, images, and your previous year's questions, as I've told you earlier as well. Now, how you have to revise all of these notebooks. Some of you might be thinking, इतनी सारी notebooks बता दी, ये revise कैसे करनी है? बहुत easily revisable है. Early morning में, if you guys must have watched my previous video, I have told you there also. Early morning में, you will be revising your 20th notebook. Okay. In the day, you will be revising your notes, previous year's questions, images, and your test and discussion. Again, optional है test and discussion. Okay. And in the night, you will be revising your wrong diary plus में last minute revision topics, and you'll be making your to-do list for the next day. So it's very easily revisable. 1 hour in the morning, 1 hour in the night, and the remaining of the day will be planned in the mid of it, right? And also how it is going to help you, this wrong diary plus last minute revision topics कैसे help करेंगे? First read and first revision तक you can keep on reading it from head to toe, no doubts in that. Okay, from the second revision, please start going retrograde. Now what do we mean by that? Retrograde का मतलब है second revision से you will not start reading your notes from head to toe. You will start with your previous year's questions, with your subject wise test, with your GTs, and if you have your DVT will be obviously conducted 2 months before the exam if you have attended that DVT. अब ये जो हमने wrong diary बनाई थी, we had this wrong diary with us which has 4 parts, one for PYQ, one for subject wise test, one for GT, and one for last minute revision topics. Now in PYQ also we have this is my wrong, this is my volatile, and this is my new. So now when you are going with your second and third and also final revision, you know that not the entire notes have to be revised, but these topics of wrong, volatile, and new, of previous year's question, of subject wise test, and of GTs have to be revised. You have to focus on these particular thing. And those of you who are a TND and DVT student, you can even go ahead with the important topics from tests and discussions and DVTs as well, because obviously they are also a very, very wonderful source of the preparation. You get the most important stuff there as well, right? So that is how this wrong diary will be helping you in your subsequent revisions, and you have to learn to use it away. It's not that banally and you have just left it. You have to understand the technique of using it and being using it effectively, right? And making the most out of it. So I guess that is how you should actually go ahead with these things. So I guess these are the 4-5 notebooks you should have in your hand, apart from your notes, your 20th notebook, your wrong diary plus my last minute revision topics, your mini diary, your test and discussion notebook. You should have all of these things in your hand. Now just a small thing which I want to just tell you about this will be that those of you who are going ahead with the preparation and are going good with the flow and want to boost their preparation and want to do something additional and feel like, okay, we have time, we can spend time on that. So somebody who's targeting INICT, I have told earlier as well also, the AIMS capsule, the emergency medicine, and the preterm baby package videos on YouTube are really helpful for somebody who's really targeting INICT, right? Apart from that, somebody who's targeting Neet PG, those students can really focus on these four topics, four short courses, which is first of all is a must know topic course, which is there in DAMS, in which subject wise they have discussed the most important topics which you should be knowing from every subject. Again, now these sources are not a compulsion. These are only and only for students who feel like we want to do something extra to boost our preparation. जो basic है we have done, we want to do something extra. Master topics first. Second is the DAMS clinical rounds, where they pick up a topic and they are discussing the clinical aspect of it, because exam is getting clinical these days, so you need to know that how a question can be popped up in the exam, right? You can go ahead with those sessions. They are conducted, I guess, almost every Wednesday or Thursday. I'm not sure about the timeline, but you can go ahead on their DAMS eMedico's channel and you can figure out what are the exact and right days for this particular course. Third will be the DAMS integrated rounds, which whereby two teachers, they are going to discuss on a particular topic and will tell everything about that particular topic and will tell you how to actually integrate topics and learn and remember to be able to mark the MCQ absolutely correct in the exam, right? So this is the third thing. And the fourth thing will be ECG as a short course. A lot of us are very scared of ECG, and when the question pops in front of us, we feel like ये तो होगा ही नहीं हमसे, and we just skip and move to the next question. But ECG, there is a short course as well in DAMS eMedico's only, and it has been very clearly and beautifully explained there to you to be able to solve the basic ECG. मतलब hi-fi ECG तो obviously you will be dealing with in residencies, but at this point of time, what is required from Neet PG point of view, I guess that is going to be discussed in that particular course, right? So you can go ahead to boost your preparation a little bit, but otherwise basic jo hai, notes, images, previous year's questions, GTs and these 3 notebooks which I have told you, they will be more than enough. Nothing beyond that is supposed to be done at all. Okay, so I guess that's it for the notebooks which you have to make. And out of all of these notebooks, please, I mean all 3 of them are important. 20th notebook, wrong diary plus last minute revision topic and the mini diary, all 3 of them are highly important because they will be really helpful and beneficial for you towards the end of the preparation, right? So yeah, that's it. I guess if there is anything apart from what I've told you in this video and you want me to talk about regarding this or maybe any other topic in relation to the Neet PG preparation or maybe anything else also, please feel free to drop the comment in the comment section or text me on the Instagram. I will reply there as well. Okay, so till that, take care of yourself and all the best.